Yeah, a little hard to talk. So I'm on day number 3 of my day 3 since my thyroid removal. It's looking, ugh. I got the drainage tube in because it's got a lot of fluid still draining out. So yeah, I had papillary thyroid cancer is what they said. So it had to all come out. They had to take out a couple of lymph nodes. I think like all of the right side or something. I don't know how many is there, but and all of the thyroid. And I was only supposed to stay one night, but they said that my levels weren't where they should be, so here I am on night 2. Let's see. Yeah, night 2. I'm pretty sure I'm going to be here for probably a week from what they're saying. Because they said they're having a little bit of trouble because, of course, my parathyroid glands, they've decided that they don't really want to work like they should. They're working, but they're not working good. And then my vitamin D is dropped, but they're hoping that that'll straighten out once the swelling goes down. They said they had to do a lot of digging in there because it was pretty bad. So my neck is just killing me. Try not to touch it, but there's like no sleep in this hospital. Every time you go to sleep, they will wake you up every 30 minutes. I swear I saw every 30 minutes last night. So, according to one of the nurses, they kind of do that on purpose because they get better blood work at nighttime when you're sleeping. So they have to come in here and wake you up and get as much blood as they can while you're sleeping. I don't know. Because they don't come as much during the day, but they sure come at nighttime. And they gave all my drugs, and they started me on Centroid, so far I haven't noticed any problems, but I know some people said it took a while for them to be on it before they noticed any side effects, but I haven't noticed anything. I just know that they started at me at like 100 grams, I think. I'm not sure exactly. I just know he said 100 something. They said that it looked like I was maybe a stage 1 of papillary thyroid cancer, so I'll have to go through I'll have to eventually have the radioactive iodine, I think it is. I'm not sure how that works, but I've heard that it's usually only like 1 or 2 days of treatment. So hopefully it didn't spread anywhere else. They said they think everything was just mainly right there in my neck area. So I'm really hoping it didn't go nowhere else. I think it's always going to be in the back of my mind that maybe it's going to be, in my lungs or something. I'm sure that's normal. That maybe you guys can tell me out there if you felt the same way when you got the news. And then it was really nothing. I know my doctor said that, I got the good cancer, but I don't really feel like cancer in general is just not good. But I don't know. But I'm ready to get out of here. I'm ready to go home. I hate being in the hospitals, and they've got me on a steroid. They said it was to try to speed up the healing process because of all the digging they had to do. So they gave me a steroid. They've had me on a bunch of stuff. Every time I come in, they're giving me a pill for something. I hate the steroid the worst, so that obviously. Nope. Hopefully I made the right decision. Get it all out. Hopefully, I won't have what, some people said they caught theirs too late. And My doctor says that he thinks that mine was caught just in time. If I'd have waited another year, he said it probably would have been more than just a couple of lymph nodes. But I don't know, in my mind, I'm worried about what if it was somewhere else and they just haven't found it yet. So, the surgery was definitely rough. Some people said it wasn't painful for them, but it was kind of for me. My throat swelled really bad, so to a point where I could barely get the pills down. I had to use like a applesauce trick that one of the nurses knew, where you could put your pill in the applesauce in small pieces and swallow it that way. It worked. Thank God, because it got stuck and choked me when I first tried to take it. Because I literally can just choke on a little piece of, like, probably rice right now, because it's so swollen on the inside and the outside. So, but it definitely hurts to talk, so I'm about to cut my video kind of short. I just wanted to make a video because I said I would. But the surgery, I think my surgery, they said, was about 2.5 hours. It took them about 2.5 hours of actual in the surgery room doing everything. And then I think I was asleep for like another hour and a half or so. So when I woke up, I was kind of pretty out of it, and they were just poking me and stuff like that right when I woke up, pretty much giving me different things and moving me around and taking a bunch of blood every time I turned around the first day. So, giving me some pain medicines that make me really out of it, but there wasn't enough pain medicine to keep me knocked out so that I could actually sleep, so I didn't get no sleep. My hair is a mess too, so I'm like, oh well, I don't care. I'm in the hospital. I don't think you're supposed to look that great anyway. You're in the hospital. I feel like I'm all beat up because I've got like bruises. They keep stabbing me in my side. I got my arm. And then they stab me in my, right there. And then I've got this thing in here that hurts. This IV. So, and not to mention I got stabbed in the butt and on the side with needles, so. For the steroid injection. Oh no, not the steroid, the heparin blood thinner. So that's where they stabbed me in the butt and the side with. Fun. But day 3. Actually, this is day 2. It's going into day 3. Yeah, it's day 2 going into day 3. Still feeling pretty rough. My voice, so far, it seems to be pretty good. I can't really get high. And if I use it too much, it starts to go out, which, according to the doctor, it may go out within the next couple of days because swelling's, kind of going back and forth. And my mom said, don't use your voice that much. And my doctor was like, it doesn't really matter. I mean, when the swelling goes, it may come and go for a couple of months. He said like up to 6 months. Some people have, a hoarse or low voice for about a year sometimes. So my nephew's texting me. That's why I was looking like he's worried about me. But hopefully we got ahead of it. Hopefully, I'll do good on the thyroid. I think it's what it's called. And maybe you other guys, if you watched the video, you can let me know what your thoughts on it were. If you did good and you had no problems, or when you started noticing problems. So that way I can be on the lookout. I know that, some people said they did good for the first month or so and then had issues. And I have 2 friends that they both said that they take medicine for thyroid and they have no thyroid and they're just fine. So I'm hoping I'll be that lucky. But it's definitely going to be an adjustment period from the looks of it. My doctor's having a hard time finding that dose that's good enough to send me home. hopefully I won't be in here a week. I don't want to be in here a week. I'm ready to go like tomorrow, but I know he said it's not going to happen. Probably going to be Monday. And that's a maybe, he said. I'm bored. I want to go home and lay in my own bed and suffer there. Anyway, I'm going to get off because I don't want to make a long video when my voice is about to go. But if you have any thoughts or anything you want to tell me now to look out for, or what I got to look forward to, you can leave it in the comments. And thank you. Hopefully this helps somebody else, or at least gives them some hope. The surgery was definitely not as bad as I thought. It's just quite painful. It's more so painful because your throat hurts on the inside and the outside, especially if they have to do more than what they originally were going to do. Like I have the tube that wasn't planned originally, but because they had to go in there and dig around and fight, and apparently my thyroid was stubborn, it didn't want to come out, and they had to like literally rip it out basically. So, but I can still talk, so I'm glad for that. I still got somewhat of a voice. Anyway, just let me know what your thoughts are in the comment, and hopefully this helps somebody else out. If you have any questions, you can ask. I'll try to answer them the best as I can. I'm still learning myself. All right, bye. And thumbs up if you like the video.